Women's Health Wednesday now. April is Alcohol Awareness Month, the time to raise awareness about alcohol use disorder and the damage it can do. Dr. Angad Madan, Medical Director of St. Peter's Addiction Recovery Center, sat down with Christina Rangio in studio to talk more about the higher risk of alcohol-related health issues in women.
You know, this is a huge concern. It is prevalent. Tell me how often you are seeing AUD in Spark, in the Recovery Center.
Oh, I have to say at least 50% of the cases that we see at Spark are having alcohol use disorder as their primary substance use disorder.
It is huge.
Absolutely.
Talk to us in terms of a definition of what the disorder specifically means, because this is a disease.
Alcohol use disorder is a chronic medical condition, no different than type 1 diabetes, congestive heart failure, hypertension, or hyperlipidemia. It is a brain disorder. It's also known as a brain disorder, which is characterized by a compulsive use pattern with a loss of control or an inability to control or stop using alcohol despite having adverse social, occupational, work-related, or family-related consequences.
How do you know when you have a problem? Because I know there are some signs and some things that you've mentioned to me.
We typically recommend patients can do a self-screen questionnaire at home to identify problematic alcohol use. It's called the CAGE questionnaire. So the questions that typically patients could ask themselves is, have I ever felt the need to cut down on drinking? Have I ever felt annoyed when other people criticize me about my alcohol use? Have I ever felt guilty about alcohol use? And, lastly, have I ever needed an eye opener? Do I need to, whenever I wake up in the morning, do I need to have a drink to steady my nerves? If you have 2 out of 4 of those answers that are positive, or if 2 out of 4 of those are a yes, then you probably have problematic alcohol use, and you should talk with your primary care physician or seek addiction treatment services.
Okay, and we will talk about those services coming up. I wanted to get to a little bit with women too. Why are women more affected in terms of alcohol-related illnesses? What are some of the contributing factors there?
Yeah, women, the rate of alcohol use disorder has been increasing in women. More significantly, the increase has been higher than compared to men. And contributing factors include, for one, biology. Women weigh less. They have less body water. So they are more quickly and rapidly affected by the effects of alcohol use, and they're more prone to intoxication, hangovers, and blackouts. So it's easy for them to have a higher blood alcohol concentration. Another factor is social media. Women, the National Survey of Drug Use and Health has shown that women view alcohol use as an important social aspect of life. And so social media has been playing an increased role in that as well, especially among young women. So that's something that NSDUH had reported in their statistics and their recent research that they did. And then another factor, contributed to that is the kind of, I'm losing my train of thought here, but the kind of, women have co-occurring mental health disorders. Women, particularly who have major depressive disorder and generalized anxiety disorder, do have a higher prevalence of developing an alcohol use disorder. So co-occurring mental health conditions.
So let's talk about treatments, how the Recovery Addiction Center can help people who are affected.
St. Peter's Addiction Recovery Center is open to the community. We welcome everyone and anyone. Don't be ashamed to come in. It is a chronic medical condition that needs medical treatment, just like congestive heart failure, hypertension, or hyperlipidemia, or type 1 diabetes. So you can come to our, if you feel like you're in acute withdrawal or needing detoxification, please come to the St. Peter's ER. They can medically screen you for observation on our 6th floor detox unit, so we can safely detox you off of alcohol so you don't have seizures or DTs. If you're not in active withdrawal or not needing detoxification, you can present to our rapid access clinics. We have walk-in clinics, one of which is on the 6th floor of St. Peter's Hospital in Albany. The other one is in Spark-A-Hose. We take walk-ins every day. You can come in and see us, and we can talk to you about life-saving, medications for alcohol cravings, namely naltrexone and the once-monthly Vivitrol injection that alleviates cravings for alcohol use.
There are resources available. You just have to reach out. Doctor, thank you so much for coming in to talk about this important topic.
For more resources and to find all of our Women's Health Wednesday segments online, go to news10.com and look for Women's Health under the Community tab.